Hi, everybody, and welcome to today's webinar, Co-Created Responses to Crisis Situations. This is episode 2 of the Emma webinar series, Health Management in Action, Fostering Health Systems Resilience. These webinars are co-funded by the EU for Health program of the European Union, although of course the views are of our speakers and sometimes of Emma as well. So thanks for joining us today. The next slide, please. I'm George Valiotis. I'm the Executive Director of Emma. The next slide. So to start, I'm just going to tell you a little bit about what Emma is. I think most of you do know us. We have our vision of excellent health management for a healthy Europe. Our mission is to support the spread of knowledge on effective health management. And so effective knowledge is things like this webinar as a great example of bringing people together. And we do that to our values. We're the only membership organization in Europe to bring together the full diversity of the health management ecosystem. And that means we bring together academics, practitioners, health managers, decision makers. We're well recognized as a respected amplifier of best practices. And I hope you'll find that in this webinar today. And we really want to provide an environment where evidence, challenge, and experience are valued and complex debates on current topics can take place. So hopefully in today's webinar, you'll experience that. This series we really created on health management in action to foster health system resilience in order to discuss topics like health management, like improving health system preparedness and responses. And for those of you who've been to our webinars before, you'd see a real diversity of topics. And in this series, this is number 2, and we've got several more to come. So do pay attention to our social media and our website to stay informed. And if you're on our mailing list, then you'll be keeping up to date. Just a bit of practical information before we move on. I think most people have practice on these things, but please do keep your microphone muted. If you've got questions, we really encourage your engagement. I mean, these webinars are here for you. So feel free to type your questions in the chat box, but we can also activate your video and have you engage directly. We are recording this and the materials do go up onto our website. So you can check out any of our current or past webinars at emma.org. And we do live tweets. So if you're not already following us on Twitter, if you could quickly do that now and add us to your list, that's at EmmaInfo. And we use the hashtag EmmaWebinars to share information about these. So feel free to engage and to add your voice. So that's the practical information. Now, technically, what we're going to do is spend 10 minutes having this welcome and introduction, and I'm already saving you time on that. And then we have Mr. Nabil Jamshed, who's going to be our presenter for today. And you can see we've got 20 minutes for that presentation and 15 minutes of Q&A. So really a lot of opportunity here for you to engage. And then additionally, so that's the webinar will officially finish in about 45 minutes. And we like to keep them bite-sized to fit into your lunch breaks and a suitable time for you. However, if you did want to stay around and network with other people in the room and swap some ideas, then we also keep the channel open for just general networking for another half an hour. So you're welcome to hang around if you wish to, but you don't need to. It's just an additional thing we offer. So now, without further ado, I'd like to introduce to you Mr. Nabil Jamshed. He's the head of corporate governance at Guy's and St Thomas's Hospital, the NHS Foundation Trust in the United Kingdom. He's been engaged with Emma for a long time. And Nabil, it's great to have you here with us and real pleasure to see you presenting this topic. I'm very excited about it. Welcome.
Thank you, George. And thank you for the warm welcome. I hope people can hear me and see me okay. A thumbs up will do the job, so I know I'm talking and people are listening. So I'm really excited to talk today about what crisis is and how do we actually go around management of the crisis. But before we do that, I think reflecting back on my 2.5 years worth of life, I'm not sure how many times have I used the word we've met another unprecedented times. I'm running out of space to create the energy in the team to say, oh, we've got another unprecedented time. And then we talk about back to normal, and people ask me, which normal are we talking about? You know, business as usual, which wave 1, wave 2, wave 3, heat wave. And now, as you know, over the last few days, we must pay our tribute to the Queen and respect for her. As you know, she's demised. So there's quite a lot of activity going around in London, especially where we are at heart and center of delivering care. So crisis is something that is kind of become part and parcel of lives for the last few years. But let's try and focus on what do we actually think about when we are talking about crisis, and how do we actually go around managing it? And I think the first question is why. If you could just pop to the next slide, please. Sorry, just keep on the same slide. Sorry, Kate. So when we are thinking about, sorry, back to the previous slide. Sorry. So when we are thinking about crisis, the key bit in the crisis management is the leadership. The buck stops with the boards. The buck stops with the senior leadership of the organization. And what they need to think about is they need to think about key things. And those key things are, we need to be thinking about our vision. We need to be thinking about what are we trying to achieve here? What is our strategy? And that is a key leadership skill. In the main, what we are trying to manage is a risk element of it. There's a lot of unknown. How do we actually go around ensuring that we have covered all bases? Or how do we manage the impact? How do we manage the likelihood of that happening again, and so forth? And within all that, how do we actually manage the reputation we have? We cannot put our reputation at risk. That's the end game. However, we need to bring our stakeholders and shareholders confidence alongside that journey. We need to ensure they are assured that we are doing everything we can to get back to business as usual. We need to be absolutely supporting our staff, who are the key members of holding the fort on our behalf in the organizations, to ensure that they carry the burden to run the frontline services. And I'm talking about a big, large hospital. One of the largest organizations, healthcare organizations in the world is perhaps Guy's and St. Thomas's. We've got 25,000 staff. So the magnitude of what we're dealing with is significant. We need to be reliant. We need to build our resilience day in, day out in what we do. It needs to be baked into the whole organizational structure. And most importantly, which, people talk about governance is boring. Well, governance is sexy. Regulatory requirements exist. Yes, they exist for a reason. If you comply with the requirements, you will need to not do anything else, because you will already have covered all the basic bases of being resilient organization. So in a crisis, when the stakes are high, scrutiny is intense, the board has a unique role to play. We cannot be stepping into the phase of to say we are comfortable with it. It is an uncomfortable territory, and we need to think about what are we going to do, what is our options, but stepping aside is definitely not one of the options. Next slide, please. So what I like to do is I like to pose a question, and you will soon be sent to a room. So there will be breakout rooms. In that room, in a very quick 5 minutes, all I want you to think about is how to lead in a crisis. And if you can come up with what are the 3 C's in a crisis? Crisis always starts with a C, we know that. But what are the key 3 C's? So by a magic of a button, my colleagues will help us to get into the breakout rooms. You will be assigned to one of the rooms, and you will in those rooms, please discuss how do we lead in crisis? What are the 3 C's in your opinion? And be ready to feed back to the plenary in 5 minutes. You could always use a chat to feedback responses, and then we'll have further discussion about what do we mean by this and how do we actually take that forward. So I'll pass it on to Kate to help us do the breakout rooms. So again, just recap, 5 minutes, quick discussion on what are the 3 C's, how do we lead in crisis, in your opinion, in your words. So I think really useful discussion. I think in our group, especially, we talked quite a lot about what the C's might be and how do we actually go around leading in crisis. I'll be quite interested in just having a quick round, no more than 2 minutes, just to get any reflections from anybody who would like to come off camera, off mute, and share their thoughts around what we discuss in the breakout rooms. So if I could please invite people to come off mute and just share their views, that'd be really helpful. You can raise your hands or you can just come off mute, that'd be great.
I can take it if you want.
Yeah, please.
There you go. So the 3 C's for us were kind of the approach that we should have to to the crisis. I don't know if this was your initial question, but our idea was to find 3 C's that we need to approach and solve a crisis. So we are thinking about good communication skills, C, communications. Then competence that regards skills, knowledge, roles, and maybe also some character in leadership. And finally, cooperation, either individual or group cooperation, and also cross-border cooperation, if you want to think it in a larger scenario. That is the idea. Well, if you want, we have talked about a lot about resilience, and I think that these 3 C's are a good component of resilience in crisis management.
Fantastic. Thank you so much, Jacopo. Apologies if I'm not pronouncing your name right, but
oh, that's perfect. You can also call me Jake if you prefer.
That's fine. Thank you. Any other thoughts, and anyone else? Just maybe 2 more if we can. Okay, I don't see any hands. I hope my colleagues are managing hands if there's anything in the chat. If not, let's continue with our journey on the presentation, if that's okay with everybody. So when we're thinking about crisis, I think it'll be absolutely mission critical to differentiate the crisis with the management aspect. So we need to understand what crisis is. So crisis is not a bad day in the office. It's not something that happens, just like a one-off, which is within your management gift to manage. It always requires an executive level response. Once we know what do we actually mean by a crisis? And there's a fantastic definition of it in British Standards Institute European guidance about them. And then when we think about crisis management, it is a special strategic discipline that enables organizations to leave what they're doing on day-to-day basis behind and enter a very different model of governance. Okay, that governance model is what defines how are you going to actually lead, interact, and change in behaviors when you're dealing with a crisis. So we heard earlier there is a character to crisis. So what you would do is normally when you're dealing with crisis, you will have leadership skills, but when you apply those skills in a crisis management situation, when you're trying to reflect and react to a crisis, that will be different. You will not lose your compassionate skill, for example, but you will do things differently. You will use that compassion slightly differently. You'll deploy your resources differently to think about what options are faced. So I'll ask you the question about the 3 C's. So thank you for putting the slide up. I think for me, when I think about, try to sum up, there's so much you can say within that framework. The first and the foremost and the most important of all is, the first C is to communicate, communicate, and communicate. Without that, you just will not achieve the desired outcomes. And it's really important to do it from right at the start to right towards the end and whatever happens in the middle, and be very clear about what that means. When there's a command and control, often what we think about is the other 2 C's are command and control. So often what happens is you will hear command and control used as a collection of words together. They are 2 very different things. When you're in a command approach, the NATO term defines it quite succinctly that authority is vested in an individual to set the direction, coordination, and control. Whereas the control equally is important, but the authority is exercised by a commander over part of the activities of subordinate organizations or people within the organization who are under their command. So in command model, what you will have is you'll have directions coming from the center to say, this is what needs doing. They will define what needs doing, okay? It won't, whereas in control model, what will be is it will be outline what needs to be achieved, and you will be left to decide and develop your own processes and your own framework to deal with the crisis management situation. So you will have a little bit of leeway. Now, command usually applies when there is a highly critical incident, and that is widespread, when things are affecting the organization as a whole or a nation as a whole, or they are big scale things, whereas control is limited to a certain degree of sensitivity when a crisis occurs, and it depends on the risk management scalability of the situation. So it's really important to understand the concept and the differentiation between the command model and the control model. They're very two different things, and they need a different sort of reaction and action towards it. If you could just go to the next slide, please. I think when we're thinking about that as a model, what we need to be thinking about is that we will need a framework to operate in. Within that framework, there'll be quite a lot of things happening. You will not be doing your day-to-day. As we heard earlier, it is not a day-to-day situation, okay? So when we are thinking about that, within that, you will have a task. A task will have a defined purpose. You'll have a plan. You'll have decisions to make. You'll have risks to manage. And those risks will be very agile. They'll be upcoming to you from your ears, pretty much, happening on the ground, what's changing, not changing. There will be teams. The teams are there to come together to ensure that the activities are coordinated effectively and efficiently. Communicate is definitely going to be there. You need to encourage challenge, because in the crisis situation, we are thinking on our feet. We might get things wrong. So if you think something's not right, your framework should allow you to encourage challenge. You need to be thinking about the followership. You need to be thinking about the learning model, that you need to learn as you go. What you can't do is let the whole situation run, take account, and then reflect upon how do we actually learn from it. You will need to embed learning within every single stage of your crisis management situation, and it needs to happen. You need to think about the individuals, look after your people. It's a most important aspect. You need to look after your staff. They are there to support you. If you don't look after them, you don't look after their well-being, it will just not be right. We've seen in COVID, what has it done to people's well-being and their health and their well-being and their mental health, for example. If you don't look after people, they will soon get to the burnout situation, which means your frontline delivery of services, specifically in a healthcare environment, the clinical services we deliver to our patients will be greatly affected, because people will not be operating at their best. So be a leader, be with them. Your actions should show compassionate. Your actions should show what you are holding them to account for, what you are all about. So we need to be really clear about those aspects. So if you could just go to the next slide, please. So this is taken from one of the military handbooks called Joint Concept Note. I think that this sums it up. The nature of persistent state-on-state competition continues to challenge traditional linear crisis response, command and control processes and structures. Defense therefore requires an applied operating concept doctrine and new approaches. So what we are saying here is, I think it's a fantastic model to think about, that what we can't do is to deal with the crisis of today's world of the 21st century in the way how we were dealing with the crisis probably 5 years ago. We need to have fluidity in our processes. We need to allow the agility within our processes. We need to allow multi-domain spectrum approach that allows us to think and cross-fertilize ideas. It needs to be a learning environment where we're learning from left, right, and center. And we heard about the cross-border learning earlier from a colleague, Jack. So I think, again, these are the things we need to build into our frameworks, rather than going a very traditional approach to crisis management. And that all is around governance of it, that how do you actually put a framework of governance that allows you to be fluid, but yet makes you ensure that you are assuring regulatory framework, you are in line with what is required of you, you're still dealing with your patients in the most effective possible way, and actually ensuring your staff are safe and well treated. Next slide, please. So during a crisis, there will be multiple stages within your journey. You probably will start with a command and control model, which is right at the top of it. And there will be traditional hierarchy. You'll have people sitting at the top who will be guided in a traditional hierarchy. But soon enough, we saw that in COVID happening quite effectively. You need to adopt teams within a hierarchy where teams will go into a collective mode of thinking space. And that thinking space is very important, where they actually harness on the ideas of what are we trying to achieve, how are we going to do that. You need to allow within your governance frameworks that allows that thinking space, that innovation thinking within the crisis management situation. And you have multiple teams, but the real trick will be that how do you draw all of that from individual teams' ideas filtering and coming up right to the top, and how do we actually learn and bake that into it? And soon enough, before you know it, those teams will go into the network mode. They will start sharing ideas amongst themselves. There'll be teams within teams that will be created. And before you know it, it'll be quite complex business going during crisis. However, the key bit to hold on to is the commander needs to collaborate. You absolutely need to ensure that within your frameworks, within your crisis management, as a leader, you've built an agility that allows you to have a network adaptive teams who are under the control, who are collaborating, and you are learning from them, and you have the ability and power to listen and learn from what is happening on the ground, what ideas are coming, how can we react differently, how can we deal with things differently. That will have an impact on the people that we serve. Next slide, please. So within that, when we are thinking about, again, the governance, what it needs to have is it needs to have a concept-driven governance. It needs to have cross-defense lines of development. What you can't have is just one safety net. You need to build multi-safety nets within your organization, and that will give you the resilience you require. And those safety nets need to be within the teams. So you need to create that network of resilience and safety nets in each of the team you face, in each of the systems you use. What you can't have in a crisis situation, a single point of failure. So you need to be thinking about, if it is a multiple point of failures or a failure that affects everything, what are we going to do? How are we going to respond? You need to be aware of your resources, what you have to hand. And if you do need other resources, you need to bring them in. You need to be thinking about, how do we actually develop experimenting through the crisis management situation? With COVID, again, we saw the development of the vaccine was done within a year, never done before in life, and they were still experimenting. How are we going to ensure that we have got variants versus protection available? Every variant was different. You need to be informed by research. We need to make sure this is science-based information, okay? We need to support, enable. We need to ensure that whatever we do is programmed. It needs to be managed. Back to the point we were covering in few earlier slides, you need to have a framework, and that framework needs to be well defined. You need to know what are you going to do when. So action cards is something that is defined in Civil Contingencies Act in the UK, that for a certain situation, if you are a category 1 responder, for example, which most of the acute hospital trusts are, or frontline police services or firefighters are, there's a list of things you need to be doing. It's like a plane crash. When there's an emergency at the plane, they open the manual, they go through that checklist, they ensure everything is done to the procedures. So you need to have that program listed. You need to think about your strategy every single time, every day, every minute during the crisis. If your strategy is about delivering care to the patients, you need to ensure that happens throughout the crisis. And most importantly, you need to be a learning organization. You need to develop those frameworks that allow you to do that. So if you could just jump onto the next slide, I'll finish in 2 slides, I promise. So the next slide is just showing a different way of thinking, which allows us to go into the sphere of what I call integrated emergency management cycle. You think about anticipation, which is your proactive working about the crises that may occur in the future. However, this is not about scenario-based planning. You can never be prepared for every single scenario that happens, okay? What we can be prepared about is that we have resilience built in within our systems. We have a framework that allows us to respond to any emergency that occurs. You need to be assessing those situations, what that might look like. You need to be thinking about the impact that may have on whoever that you deal with, your stakeholders. How are you going to prevent that? How are you going to prepare yourself as executive colleagues, as managers within healthcare or beyond to work collaboratively? You need to be mindfully ready. You need to be physically ready. You need to be process-oriented ready. There's so much preparation that needs to go in. So start early is the point, and ensure that it is there when it's needed, not to leave it alone and then think about, oh, we've got a crisis, now we create the system. Only then you are able to respond. And in that response phase, as we said earlier, you need to be agile. You need to be really thinking about how we're going to do what we are going to do. And recovery, if you could go to the next slide for me, please, in the meantime. Recovery, when I go for my run every morning, my watch tells me every day, oh, recovery is more important than the workouts. So I think we really do need to put focus and emphasis on that during the crisis, we have this energy, we have this adrenaline in our bodies, we are responding day in, day out. However, it's really, really important to be reflective after the event, to think about how are we going to recover, how are we going to restore, if it needs rehabilitation. And I don't mean rehabilitation in the mental health sense, but the organization will need rehabilitation to think about recovery from an emergency, okay? So it's really important that we do that. So the benefits of doing integrated planning or integrated emergency management is that the treatment of emergency as an exploration of business is as usual. The minimization of untried and obscure systems is reduced. A high level of senior staff familiarity occurs. You have greater facilities to deal with. You will have direct link with just-in-time philosophy versus what we need to do as business continuity. The approach is validated by continuous testing and exercising. So the basic framework plans, the standard command and control structure, the flexible application by skilled, trained, high-quality professionals is absolutely critical. But at the core of all that is you need to ensure your teams are competent, they are trained enough to deal with these situations, they're familiar with these concepts, and they know what's coming. So if you could go to the next slide for me, please. So I think in a way, how should you lead in a crisis was a question I posed to you right at the start. What you should do is you should first and foremost listen. Listen, listen, and listen. The power of ideas generation, how to deal with the crisis, will come from your teams. You need to learn and absorb what's going on. You need to think about how do you actually, in the crisis moment, will learn and change our practices. And most importantly, lead by example. Your words and your actions should meet up. What you can't have is that in a certain situation, you will say, in my plan, I will react in this particular way. But when actually crisis happens, you don't. That will be the biggest failure and a drawback to your staff. Next slide, please. And lastly, I think it's really, really important, KISS, and I don't mean KISS in any other way, but KISS is really keep it simple and short. Whatever your planning is, it has to be absolutely specific. It needs to be buttoned down. It needs to be communicatable and understandable to the staff that we deal with. And one thing to take away, next slide, please, to your organization, when you go back today into your places, you need to be asking these questions. Do you have a document about crisis management in your organizations? Do you conduct at least one board level crisis management exercise a year? And do you actually have a particular board committee to take the responsibility for ensuring the assurance is monitored? Do you have a stakeholders information plan? Who do you communicate with? Do you have the plan in place? Do we have a plan for crisis for a disclosure of it? I think that is very important. Sometimes what we see happening is crisis occurs and we miss the boat of informing individuals. And what that does, it damages the trust you built with your teams over the number of years. Only one occurrence will lead you to mistrust situation, and that's the last thing you want to develop, because that will lead to your shareholder interest going further down, your confidence is going down, you'll lose your market, you will lose your credibility. That's the last thing you want. And I think the last question is very important as well. Are the board and senior leader management ready now totally for an unexpected crisis? Okay. So I think with that in mind, I think it's a really useful exercise to think about. The key messages are, we need to communicate, we need to learn, we need to be agile, we need to be thinking of our staff, and we need to ensure we do it right early on. Don't wait for another disaster to happen. Do it now. Now is the only time. With that in mind, thank you so much for listening. I'm passing it back to my team and opening up for Q&As.
Thanks, Nabil. That was absolutely fascinating. I was completely transfixed, and I'm just reaching for the reactions to give you some applause, because that was really brilliant. Thank you so much. We've got just 5 minutes left officially for question time, and then, as I said, there'll be a networking opportunity just after. But if anyone does have a question, feel free to put your hand up, and we can hear directly from you. So I see applause. Oh, and a hand up from, oh no, Evelyn, you're applauding. Okay. So this is a chance if you have any questions about Zachary. Over to you if you want to switch your camera on, if that's possible, or otherwise you can just unmute yourself and ask a question.
Yeah, sorry. I was just curious because obviously there's kind of two types of crisis. So one could be internal. Let's say there's staffing issues or something that causes a crisis from within, and external. And I wonder how you see the response maybe needing to differ to the two different types of crisis.
Thank you, Zachary. A great question. I think when we are talking about internal crises, what you need to be able to do is you need to be able to define what my business continuity looks like. So if, say, the internal crisis is something that you can manage within your team for a period of 2 days or 3 days, something that you can manage, you need to have resilience built within that. Then what will it mean for my activity that I do, whatever the business you're in? How many staff might be impacted? How do we actually ensure that staffing and resources are available? What response will be required to recover? If the recovery time is, say, the crisis was 2 days, but the recovery is 2 weeks, I'm talking about an IT incident here, for example, in that time, how are you going to ensure what you need to do, you need to be doing? So the response for that is going to be quite local. But within that, for instance, if that impacts on external parts of the organization or other parts of the organization, again, the bit is to collaborate. You need to create that network within the networks to be able to communicate wide across the organization. Whereas an external crisis will be very different. Say, for example, a national emergency such as COVID, a lot was led by the central governments to say, here's our response, here's what we need to be doing. There was a lot command and control both happening at the same time. Every country led a very different response to, for example, the COVID vaccine. It was an internal policy, internal decision, but impacting on the external environment we face together as a global unit.
Nabil, I've got a question actually about, you talked about defining the crisis and knowing when you're in a crisis versus an incident. And I think what we saw a lot of in COVID recovery and the COVID response is a domino effect where things felt like an incident and then another incident happened and then another incident, and in a vacuum each one was an incident, but collectively they became an even bigger crisis. So defining that crisis versus the incidents became tricky. Do you have any insight on that?
Yeah, so I think it depends on the criticality of these incidents. We were talking about the risk management aspect of it earlier. So what you need to do is you need to analyze the risk of it and both elements, the likelihood and impact. And there will be things within your gift that you can manage for that particular incident within your management gift to manage, either to reduce the likelihood or reduce the impact, okay? Now, when you think about, oh, I can't do anything about it, at that point, it passes on to somebody else's responsibility, and that is your command and control structure. Now, if there are multiple incidents and your collective risk, for example, each incident may have been categorized as an amber risk, but if you collectively look at them, you probably will come up as a red rating because the widespread of the incident. So within that criticality of each incident, it's really important to think about the impact it generates collectively. And one could lead to the other, and the other could lead to the other, and that other could lead to external environments. But defining when we are in crisis versus when we are in business continuity, when we are in business as usual, I think there are stages we need to be absolutely clear about and be prompt about defining and declaring a crisis.
Yeah, because I think about the way we saw elective surgeries being delayed, and then those delays ever increasing. And then because they're elective, at first they're not a crisis, but then what we're doing is seeing the incidence of other complexities as a result of this, which has a domino effect into other parts. And then, for example, we saw less screening of a lot of cancer, for example. So in the moment, in terms of what we're operating with, let's say in a hospital setting, you're managing just that workload. But then a new public health crisis is born from that as we see the flow-on effect. And then that crisis ends up affecting not just the health management of a hospital, then maybe the health management of public health systems, of primary care systems. So it feels like sometimes in these bigger scenarios that the crisis becomes harder to define and harder to know where responsibility lies.
You're absolutely spot on, George, on that. I think if you go back and ask those individuals involved in those discussions, they will tell you they had a fantastic business continuity plan to deal with elective recovery. Okay, they had a fantastic plan to deal with cancer waste. They had a fantastic plan to continue the business as usual. Da-di-da-di-da. What they didn't have was a collective responsibility framework that allowed them to cross-fertilize and think about it as a collective. And I think that's where it's lacking. So what we do need is, within your crisis management planning, please do consider the global impact of things. The key question here is, doing all that what we did in COVID, did we actually cause an actual or potential harm to the patient? I think actual harm, the answer might get, yes and no, or most no's, but the potential harm or the future harm is most definitely by any means is going to be a yes as an answer when you think about what it generates. So the after effect of COVID is important. And that's why I say recovery is most important post-event. And that's where your planning gets more robust. So I think you need to pay attention to those.
Okay, great. Thank you, Nabil. We have one more question. In fact, we're out of time. So if we can make the last question quick. Annalise, did you have a question?
Yeah, well, I'm sorry, I was a bit late, but I'm still not. I missed a lot, I think, because it's a powerful presentation.
Okay, we don't have much time, so if you want to make
now when I have to, this is my introduction, and I would have finished already. But what this is a sort of evaluation of a process dealing with risks, crisis. It seems to me that there's all the material put it into a training model because you found a lot of critical aspects that need to be dealt with, but there's also a training question. And have you looked at that? That's my question. Training, multidisciplinary training.
Yeah, so I think you missed the initial part. Thank you for the question.
Sorry.
We talked about the competency as one of the key C's within a crisis management.
I saw that, yeah.
And right at the end, in the last slide, you saw that we need to ensure that everyone across the organization is absolutely trained in thinking about these basic principles. What we can't do is prepare ourselves for small scenarios. What we need to be ready about is dealing with the crisis, not the situation we face, okay? If you have a framework, we have competency, we know how resilient we are, we have agility, we have the learning platforms available to us, we learn as we go, we respond, we change our practices. That's the only way to go about dealing with the crisis. And for that, you need a different mindset. For that, you need a different training elements for your board, as well as all your organization.
So together with setting up a crisis, an organization dealing with crisis, you set up a learning platform.
Yeah.
Great. Is that that's your advice? Yeah. Okay. Yeah. Thanks.
Terrific. Thanks for your question, Annalise, and Nabil. Thanks again for a fantastic workshop today.
Yeah,
really interesting information, and great to have all of you joining us. And your engagement really makes these webinars happen. Our webinars are shaped by our members and by our stakeholders. So we love hearing from you and any feedback that you might have. We're just now going to put into the chat a very small survey. It literally takes 90 seconds, less time than I take to describe it takes to fill out. But if you could answer that just quickly to let us know how today worked for you, that'd be really important for us. Now, our next webinar will happen on the 20th of September, and that one will be looking at how can funding models foster health system resilience. So make sure that's in your diary, the 20th of September at 1:30 p.m. Central Eastern Summer Time. And otherwise, I thank you for joining. I thank you for joining, and I should encourage you, as I said, members shape these webinars, and if you're not a member, do think about joining us. It'd be great to have you on board. All the resources from today's webinar will be put on our website. So thanks again for attending. So that's the end of today's session. Thanks for joining us. Nabil, thanks again to you, and we'll see you all next time.